Hello, I wanted to present on Clinical Institute Withdrawal Assessment for Alcohol, also known as ciwa. The objectives of this presentation is to identify the signs and symptoms of alcohol withdrawal, understand the timeline of withdrawal symptoms, and discuss the appropriate medical surgical staff responsibilities. So why ciwa? In 2020, 50% of people aged 12 or older are current alcohol users. Among the 138.5 million people who were current alcohol users, 61.6 million were classified as binge drinkers, and 17.7 million people were classified as heavy drinkers. Approximately 14.5 million people aged 12 and older had alcohol use disorder. So why ciwa? We care for our patients here who may have withdrawals that are related to substance abuse. And we need to be able to classify the signs and symptoms of the withdrawals so that we can provide safe patient care. So what is ciwa? ciwa assessment is a tool to classify withdrawal symptoms. Early identifications may prevent serious complications. And we also should involve social worker for these types of cases. Some things we want to identify are the vocabulary of withdrawal syndrome and the delirium tremens. So the withdrawal syndromes is the complex and physical and psychological disturbance observed upon withdrawal of the addicting agent. So the severity of the autonomic and psychomotor disturbances varies with the agents, the length of addiction, and of course the size of the dosage. Delirium tremors are severe autonomic hypersensitivity. They can have vivid hallucination, global confusion, constant tremor, fumbling movements of the hands, insomnia, and other physical and neurological symptoms. Signs and symptoms that you may see psychiatric wise is the patient's having disorientation, confusion, agitation, anxiety, paranoia, coma, restlessness, visual or audio hallucinations, amnesia, anger, or insomnia. Sympathetic, you may see tachycardia, hypertension, or sweating. Physical, you can see tremors, fevers, sweatings, agitation, anxiety, headache, nausea, or vomiting. So the timeline of alcohol withdrawal could be the hours of 6 to 8. You'll see more tremors, and you'll see the tremors can intensify by 24 to 36 hours, and it can exacerbate by motor activity or stress. The hours from 8 to 24 hours, you may see more of sympathetic or hyperactivity. This is the sweating, tachycardia, nausea, mild hypertension, anorexia, anxiety, or agitation. In the hours 12 to 24, you may see seizures. And once you see the seizures are a symptom, the severity can progress or even get worse. You also can see seizures as early as 2 hours after their last drink. From hours of 24 to 36, you'll see more of disordered perceptions. The patient can have nightmares, auditory hallucinations. Generally, these resolve within 48 hours. Day 2 to 5, you can see delirium tremens, and these begin abruptly. So what are the responsibilities? One is to identify, the other is to assess, the other is to report and educate. So what we need to identify is that the patient admits to using alcohol via our CAGE questionnaire that we use upon admission. And in that, patient is observed with the symptoms of alcohol withdrawal. We also have to notify the doctor. This is our CAGE questions. Have you ever felt you should cut down on your drinking? Have people annoyed you by criticizing your drinking? Have you ever felt bad or guilty about your drinking? Or and have you ever had a drink first thing in the morning? For the ciwa assessment, this is how it will look like if you're actually in the nursing navigator. And it will address the nausea and vomiting, agitation, visual disturbances, tremors, tactile disturbances, headache, fullness of head in the head, and then paroxysmal sweats. On your flow sheets, it will look like this. Depending on the patient's symptoms, you will score the patients per category, and at the end, you should have a total score. If the score is 0 to 9, you will reevaluate the ciwa assessment every 2 hours. If the score is unchanged for 12 hours, then we reassess every 4 hours. If the score is 5, below 5, with no medications administered within 48 hours, we'll consult the doctor about discontinuing this ciwa assessment and protocol along with the lorazepam orders. If the score is 10 and above for ciwa protocol, it requires medication and monitoring as well as reevaluation and vital signs every 1 to 2 hours. So this is how our ciwa protocol looks like. There are two regimens. The first regimen is patients less than 70 years of age and no significant comorbidities. And for regimen 2, you'll see the regimens include patients that are greater than 70 or they're on opiates, their serum creatinine is greater than 2, or if they have impaired hepatic functioning. So if your CIWA is 4 and less, you want to increase the awareness in the unit with the charge nurse, the doctors, the nursing assistants, and the ward clerk. Report with CIWA of 5 to 9, we want to make sure that for the charge nurses to have appropriate staffing and assistance. The doctor really needs to see the patient and rule out any other diseases. The nursing assistant will be our extra eyes and hands and ears, and then our ward clerks can assist with transferring if needed via Health Connect. For scores 10 and above, we need to make sure we notify the charge nurse or the DS or health supervisor. Talk with the doctor and determining transferring the patient to a different unit or a higher level of care. And the nursing assistant can assist with transferring, as well as the ward clerk can assist with transferring electronically. One of the other things we need to have for these patients is a care plan. And we would go to our patient plan of care and add a template of alcohol withdrawal and individualize this plan for our patient. What goes in hand with our plan of care is our education for our patient and family or caregiver. And we need to let them know that daily alcohol consumption causes physiological independence. And of course, when they stop, they may have withdrawal signs and symptoms may occur, and we need to inform the patient, the caregivers, or families the signs and symptoms of alcohol withdrawal syndromes, and of course, when to reach out to go to the doctors for help, or when or how to seek for help. Another thing too is we have different resources that we can give handouts to our patients. So in our clinical library, you can access it through our website inside LAMC and go to the clinical library, and we can just type out alcohol withdrawal, and we can print out the relevant information we want to give to our patients in regards to alcohol withdrawal. Please make sure that if you do have these documents or you give it to your patients, just document it in your education tab that you had printed and given out handouts for these patients. And that concludes my presentation. If you have any questions, please don't hesitate to reach out to me. Thank you.